including detailed answer explanations, why other choices are incorrect, and treatment information. Question 1. Clinical presentation. A 34-year-old veterinarian presents with several weeks of intermittent fever, night sweats, malaise, and joint pain. He mentions drinking unpasteurized goat milk during a recent trip to the Middle East. On physical exam, he has hepatosplenomegaly. Which of the following is the most likely diagnosis? A. Leptospirosis, B. Brucellosis, C. Tuberculosis, D. Typhoid fever. Correct answer, B. Brucellosis. Explanation. Brucella is transmitted via contact with contaminated animal products, e.g. unpasteurized dairy, especially in endemic regions. Classic features include undulant, intermittent fever, night sweats, arthralgia, and hepatosplenomegaly. It forms non-caseating granulomas and survives in macrophages. Why not the others? A. Leptospirosis. Common in tropical areas with contaminated water exposure. Presents with conjunctival suffusion, jaundice, myalgia, especially calves, but not undulant fever. C. Tuberculosis. Also granulomatous, but usually causes a more chronic cough, weight loss, hemoptysis, and caseating granulomas. D. Typhoid fever. Presents with stepwise fever, abdominal pain, rose spots, and relative bradycardia, not arthralgia or undulating fever. Treatment: doxycycline plus rifampin for 6 weeks, or streptomycin as an alternative aminoglycoside. Question 2. Microbiology and intracellular survival. Which of the following best explains why Brucella infections often require prolonged antibiotic therapy? A. It evades complement by producing a capsule. B. It survives within macrophages of the reticuloendothelial system. C. It forms resistant spores that persist in host tissues. D. It produces endotoxin that leads to recurrent bacteremia. Correct answer B. It survives within macrophages of the reticuloendothelial system. Explanation. Brucella is a facultative intracellular pathogen that survives in macrophages, particularly in organs like the liver, spleen, and bone marrow. This intracellular localization allows immune evasion and necessitates long-term antibiotics that penetrate cells, e.g. doxycycline plus rifampin. Why not the others? A. Capsule evasion. Brucella is not encapsulated. This is a key virulence factor in Klebsiella and Haemophilus influenzae. C. Spore formation. Not a feature of Brucella. Spore-forming bacteria include Bacillus and Clostridium. D. Endotoxin-induced bacteremia. While it is gram-negative and does produce LPS, its pathogenesis is mainly intracellular, not due to endotoxemia. Question 3. Treatment regimen. A 45-year-old farmer is diagnosed with brucellosis after presenting with fever, malaise, and hepatomegaly. He is started on doxycycline. Which of the following antibiotics should be added to ensure effective therapy? A. Azithromycin, B. Rifampin, C. Ceftriaxone, D. Vancomycin. Correct answer, B. Explanation. The standard treatment for Brucella infection is doxycycline plus rifampin for at least 6 weeks. Rifampin enhances intracellular penetration and provides synergy against this intracellular organism. Why not the others? A. Azithromycin, used for atypical pneumonia, e.g. mycoplasma, not effective for Brucella. C. Ceftriaxone, good for Neisseria meningititis, Haemophilus influenzae, and Streptococcus pneumoniae, but poor intracellular activity against Brucella. D. Vancomycin, active against gram-positive organisms, has no role in gram-negative infections like Brucella.